We continue our series, Somebody's Watching You, with a look at your health information. There's a chance that someone is looking at yours right now. Dr. Jennifer Ashton is back to tell us more about the digital threat to every patient's privacy. Good morning.
That's right, Harry. It's really out there. The health technology revolution is well underway, and the government wants every American's medical records to be on a computer as opposed to a shelf in your doctor's office. The goal is to provide more efficient healthcare services, but protecting a patient's privacy is proving to be a real challenge.
This fall, a computer hacker from the Ukraine got access to thousands of patient records at the University of North Carolina.
Approximately 160 to 180,000 women's personal identifications and information were on the server.
I don't know if they were looking for health information. I don't know if they were just looking.
What was more concerning for Elizabeth Page was that her information was even at UNC. It had become part of a study transferred without her consent from a private radiology lab.
I always assumed that if they were going to transfer my information somewhere else, that they would have to get my permission to do that.
But consent is not always a requirement. Doctors regularly and legally share patient information with health insurers, pharmacies, and researchers, all without ever notifying the patient.
And that actually is quite common in these large databases of patients.
The University of North Carolina breach helped fuel a broader debate over medical privacy and importance of protecting patient information as paper files become digital data.
We will make the immediate investments necessary to ensure that within 5 years, all of America's medical records are computerized.
To get that national database of patient records started, the president added $20 billion to the stimulus bill.
The key to the success of electronic health records is that patients control who can see and use their information.
Deborah Peel is a psychiatrist in Texas and often advocates for patient privacy on Capitol Hill.
We have no control over who can see our electronic health records. None.
So how safe will the national database be? Several private health providers have already gone digital with embarrassing breaches of patient confidence. Most notably with celebrity records. This year, Kaiser Permanente paid $250,000 in fines after 21 unauthorized employees accessed the digital records of Octomom, Nadia Suleiman.
The same things that happen to the celebrities could happen to any of us.
The patient does not have the right to control who sees their information and when. It's very important that we recognize that should be a basic right in the United States.
Now, new laws under health information technology have come online this year, and among them, notifying patients when their data has been breached, as it was in North Carolina in September.
But there really are no guarantees either way.
There really aren't, and let's be clear, even with the old-fashioned hard copy medical records, that privacy or confidentiality can still be leaked. We've seen that in hospitals with antiquated systems, and we've seen that even in doctors' offices. But online medical records are the wave of the future, and overall, the benefits outweigh the drawbacks.
All right, Dr. Jennifer Ashton, thank you.